Don't worry, I got this.
Joining me today, we are here to talk about the Q ball. More specifically, it's Myon-Q. You can find out more information about Myon-Q at myon-q.com. Myon-Q is a pain relief system. It delivers local anesthetic to the surgical site. I am actually currently equipped with a Q ball, and this demonstration is brought to you by the Ehlers Danlos Family Contributions. It's a web service that has mission to direct contributions to foundations in research for Ehlers Danlos syndrome, as well as private donations to struggling members of the Ehlers Danlos community. I have a Q ball because I have recurrent primary spontaneous pneumothoraces, which is also called lung collapses. And it is primary spontaneous because I do not have lung disease. I do not have blebs. I do not have the gene that is common with the pneumothoraces and emphysema. I tested negative for that too. I did not scuba dive. I wasn't flying. Statistically, 1.2 of every 300,000 females have primary spontaneous pneumothoraces in the United States. One other reason that I haven't listed off yet would be Ehlers-Danlos syndrome. It's a connective tissue disorder, and there's connective tissues in the lung. So that is why I chose to do this video. Myon-Q does not know that I'm doing this video, but I am definitely promoting my product here today. So I have had many pneumothoraces. I've gone in and had x-rays and they've healed. And the last one that I went for, I actually had a moderate collapse, and my pulmonologist decided that that would be the last one. And it was time for me to have VATS, which is video assisted thoracic surgery is VATS. And they did pleurodesis with talc powder, which basically means that they glued the lung to the lung cavity wall, and so that there's no more space in there for air to go into to cause that. So I had that done, and with that, I got my Myon-Q ball. So this is just the package that it comes in. It's a nice little bag. I can hold it around my neck. That's where I like to have it. I like to carry it around my neck. And the little tube that it's attached to is really, really tiny. Very, very small. But it's a pretty powerful small package, let me tell you what. So I actually have quite a bit of medicine in here, so I'm not going to show you the demonstration today, but I am going to attach it to this video so that you will get to see it taken out. Don't worry, because I will warn you before I have it taken out, and so if you need to stop the video before that happens, totally understand. So the ball has been used up some. There's some extra packaging here with medicine in the inside. It looks kind of a little bit smaller than an apple maybe, but eventually it's going to become an apple core. And when it gets that small, it's time to remove it because it's all out of medicine. This is, again, a local anesthetic that is delivered directly to the surgical site. I had this surgery on Friday. And on Friday, I don't remember a whole lot of Friday because I had quite a bit of medicine in my system. Not just this, but just lots of medicine in my system, so I don't really remember that day a whole lot. I just remember getting through it. And then Saturday, I kind of had a rough day, getting used to everything. It was all new. But I do remember on Saturday that the numbness, it was up here all the way down the front of me and all the way down the side of the torso. And just this whole area was covered with numbness, which was wonderful because the less you can feel, the better, right? And so that was Saturday. And then Sunday, I was ready to go home. I felt like it was time to go home, that I could get up and use the bathroom myself. I could move around. I felt like I could do anything. I could eat, I could use my spirometer. You'll get one of those, or you got to breathe into the machine and try to, strengthen your lungs. And, well, this is Monday, and you can hear how well I'm breathing. That's pretty amazing considering I just had this surgery. So having it numb in that area has allowed me to use that spirometer the point where it's strong enough to be speaking to you the way I am today. It's just amazing. And yes, I am standing here. I'm not sitting down. So that's pretty awesome too. I've been able to move around a lot. Now the numbness on the top of my chest has gone down quite a bit. I can scratch the skin and I can feel quite a bit of it. But underneath, like where my rib is, where the actual surgery took place, up toward the middle, I know you probably can't see, a little taller, all the way around here, this is all numb still. This up here is not. Now they had a great big huge giant chest tube drain in my side, and I was so scared to have that taken out. It was so big. I was like, this is really gonna hurt. I didn't feel a thing. And this Myon-Q ball is the reason I didn't feel that getting taken out. So I'm so thankful to have had this in. I do believe that I have had way less narcotics than what I would have felt like I needed. I remember having my gallbladder removed back when I was 18. I was on a morphine pump, and you sit there and push that button, and the darn button doesn't give you anything else eventually, and you just still haven't had enough, and it just hurts so bad. I didn't have that this time. I'm telling you what, Friday, all my pain was taken away between the drugs and the narcotics and this. I mean, there wasn't any pain. I didn't need to push a button. I mean, it was just like night and day, the difference between the two surgeries. It's excellent. Again, Myon-Q does not know I'm making this video, but it just so happens to promote their product. So yeah, I just, wanted to share with you my experience. This, I am told, probably has another day and a half, 2 days on it. And I will add to this video and show you what it looks like when you're taking it out. So I better get it right the first time, because I only have a chance for one take here. So right now, I'd like to encourage you to go visit Ehlers Danlos Family Contributions and make your contribution today. It can be $1, just to let them know, hey, your awareness got out. I learned about Ehlers-Danlos syndrome today. I never heard of it before, or if you have, either way, make your donation. Every dollar matters. We really, really need awareness. The EDS community is a very small community. We have a lot of different types of Ehlers-Danlos, but it's still a very small handful of people, just like primary spontaneous pneumothorax. It's a pretty small group of people as well. So, however, VATS with pleurodesis is not quite that uncommon of a procedure to have done altogether. Unfortunately, there are traumatic accidents and all sorts of things that can cause pneumothorax. So a pneumothorax is not necessarily all that rare. It's the type of pneumothorax that is a bit rare. So please check out EDS, Ehlers-Danlos syndrome. Check out Ehlers-Danlos Family Contributions. Make your donation to either the foundation or one of the families that are in need. They're constantly going to the doctor. They're constantly, struggling with all kinds of different things. It's really hard to keep a job. I literally just lost my job because I took a medical leave for a lung collapse. And, we were hoping it was the last lung collapse for a really long time. Well, I needed a second medical leave, and I wasn't able to get that second medical leave. So I am now in search of a job. Guess what? I got to go back in 2 weeks. I was in the hospital for 3 days. I got to go to work in 2 weeks. And this is also such short time frames for all these different things. I'm really excited that, it gets to be over and I can move on with my life this quick. And I don't think I could have done it without this cue ball. So check out the cue ball and definitely, give it a shot. Thank you very much. Have a great day. It's time to take out the Myon-Q. You could get this Myon-Q ball, and for any reason. You could get it for, broken leg, broken arm, abdominal surgery, any surgery. So you could potentially have a cue ball to take out later on in your life. So I looked at a YouTube video, watched somebody else do it, so I'm making a YouTube video for others to look at too. So here it goes. Oh yeah, let's show you up close what it looks like. This is it. That's my, this here is my surgery stuff. This is the catheter. And it goes in right there. So I'm going to be pulling at that until it comes out. I'm going to set you guys over here. Both hands for both. I'm going to drop you. Alright. So, here we go.
I see a black thing. Feeling like I'm having to tug pretty hard here to get movement, but it's coming. I got two black things now. I see a third black thing now. Third black thing is way down there, so we are making progress here. Just very slow. It's an itty bitty tiny one there. Here it comes. I can feel it coming from behind my back, actually, is what it felt like to me. That's coming out really fast and easy. Ta-da! There's the end of it. I did it. Look. I did it. I'm so proud of myself. That was difficult. Now they say that you can get, I dropped it. Oops. They say that you can get a little bit of bleeding. And you're supposed to band-aid it, which I'll go get a band-aid for it now, but I don't have any bleeding. Some people do, some people don't. It's right there, the little spot right next to the stitched part there. That's it. That actually didn't hurt me at all coming out, so, I mean, I still have a little bit of numbness, so I'm sure it's probably the medicine still working on my body, so, there we are. I hope you enjoyed the video, and I hope you have just as good a luck as I did getting yours out. So, good luck with your surgery, good luck with your recovery, and we hope for the best for you. Thank you.